Hi, my name is Caroline. I'm going to be your student nurse for today. I have an order to administer an NG tube for you today, but first I'm going to verify name and birthday. Okay, if you'll give me your first and last name. Okay, what's that birthday? Alrighty, so like I said, I have an order to administer or to insert an NG tube today. Do you have any questions as to what that is? You do? Okay, so an NG tube will be inserted into your nose and it'll go through your throat down to your stomach. And what that's going to do is that's going to release any gastric decompression. And that's a way for us to, it's like a feeding tube. It's for, feeding. Sorry, I messed up on this part, but don't count me on it. And medications, anything else that you may need like that. Okay, so I'm gonna go ahead and raise your bed to a high enough position for me because I'm kind of tall. This one right here. Having a good day today? Same. This is so weird, I'm talking to myself. Okay, and I'm gonna raise it to a high Fowler's position. Just because whenever I'm inserting this NG tube, you don't want to do it when you're laying down. Whenever you're sitting up and raised, that decreases the chances of choking or any like discomfort that you may feel. Okay, I'm gonna go ahead and take this pillow out from behind you. I'm gonna grab your neck right here. Okay, raise. All right, there we go. Sheet's coming off a little bit. That was not me. I'll put that right there. Okay. So, sorry, you had trash on you. I'm gonna go ahead and get everything ready. Is there any questions that you may have or anything like that? Are you comfortable in this position? Yes? Okay. Alrighty. So I practiced hand hygiene. And I'm going to put on my gloves. Okay. Here is the NG tube package. It is a 14-inch Salem Sump NG tube, and we are going to be inserting it into the left nair today. Okay. So I have this tube. Here's the NG tube. I know it's long, looks really scary, looks kind of uncomfortable. Oh no. Oh no. Okay, we're just going to ignore this. This didn't happen. Normally I'd have like a clean new one. I think I had difficulty getting that piece of tape off. I'm so sorry. But what I'm going to do is I'm going to measure it. So I'm going to put it right here on your nose and I'm going to take it around your ear like this. And I'm going to be going down your chest. So excuse me. Okay. And I'm going to go right here to like the middle, right under your chest. This is the xiphoid process, but no medical jargon for the patients. Okay, so I'm gonna do it like this. You are at a 60, okay? So I'm going to put some tape on that spot to measure how far to go. Go right there on that 60 line, okay? As you can see, we have our tape. Ooh, that's bothering me so bad. Okay. And I'm going to get another piece of tape already ready for when I am taping it to the patient's nose to avoid it being pulled whenever they move and everything like that. So I'm going to just rip it off and set it to the side. Okay. Alrighty. So I'm going to hand this cup to you. She has the cup in her hand. Ow. And what I'm going to have you do is I'm going to put my lube on the end of this. Please work with me. And you want to make sure that enough is on the NG tube so it's smooth sailing down the nose and through the throat on down to the stomach. Okay. Okay. All right, so what I'm gonna have you do, Mrs. Smith, is I'm going to insert this into your left nair, and I'm gonna have you take a deep breath for me whenever I do it the first time. Are you ready? Okay. Oh, just kidding. Let me educate you on this part too. Every time I'm gonna insert, I'm gonna tell you to take a sip. So before I push it in further, I'm gonna have you take a sip, and then I'm gonna insert it when you do that, okay? It's just gonna make the process easier. It's gonna be a little uncomfortable, but you let me know if anything hurts or if I need to stop at any time, okay? Alrighty. I'm going to push your head back like that so it's an easy, I'm not gonna do this to a patient, but it's just because it's a mannequin and they're stubborn. I'm going to go ahead and insert it. If you'll take a deep breath for me. Alrighty, that was good. Okay, so I'm gonna put your head back down and we're gonna tilt your head down kind of a little bit like that. Okay, I'm gonna have you take a sip. Take a sip. Scratch that. I'm so sorry, I forgot to put that down. But that was there. That was there before. You didn't see anything. Okay, take a sip. 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 Okay, so the NG tube went all the way in. I didn't know that that could happen. Okay, this is good. Okay, so I'm gonna rip this tape down the middle. Oh my goodness. Other times it would be more perfect than this, but so sorry. Okay, I'm gonna go ahead and just place this on your nose. This is just to keep it in place because whenever you're moving and laying down, I don't want you to like snag it or rip it out or anything like that, because that would not be fun. Okay, that is in place. I'm going to take this rubber band and what is this? Clothespin? And I'm going to wrap it around this part right here. Place that in there. Okay, and I'm going to pin it to your shirt right here. Okay, alrighty. Your NG tube is in place. Okay. Are you experiencing any discomfort? Oh goodness. Are you experiencing any discomfort at all? Is there anything that you need? So that would be possessions. So I made sure your call light is in hand. Bed is locked. And I'm not going to put it in a low position. I'm going to keep you up raised like this because if I do lay you down, I don't want you to asphyxiate or anything like that with this tube being inserted. But took her to the bathroom, everything like that. Just kidding. Before I do those things, I'm going to give you an x-ray. The reason that we give an x-ray whenever we insert an NG tube is to make sure that it's in place and not like coiling up or in the wrong position. Just so we make sure that everything is safe and where it needs to be. Okay, so call light is in hand, wheels are locked, side rails up ×2, and bed position is in high Fowlers. Only for an NG tube though, just so the patient is comfortable. You okay? All right, cool. All right, so basically what I'm gonna document is how the patient tolerated it, what time it was administered, or what time it was inserted, who it was administered by. Why do I keep wanting to say administered? Inserted. If the patient was well educated on the NG tube and what happens like during, how they can't eat, things like that, making sure that they're well educated on that part, and making sure that they're educated on the fact that if anything is uncomfortable or anything that they need to call us with their call light, and we'll be right there to help them. Oh, and then what NG tube you used, everything like that. So I'm gonna go in, it's a few days later, she's had this NG tube in for a while. I'm gonna knock. Hello, Mrs. Smith. I'm just going to, check your wristband. What is your first and last? Okay. Birthday? Got it. Alrighty, so I have an order to remove the NG tube. It's been about 4 days now. I bet you are so hungry and ready to get that fat cheeseburger in your mouth. So what I'm gonna do today is I'm going to set this under your nose, or under your face like this, okay? How was the NG tube? It was uncomfortable, I bet. You're so ready to get it out. I bet. Okay, we are going to unclip it from your gown. Okay. Unclipped it from your gown, just to make sure I don't poke you. Okay. I'm gonna remove this piece of tape here. Move it downwards. Alrighty. So what I'm gonna do is I have a towel under you just in case there's any drainage that comes out, and that's totally normal if it does. But I'm gonna have this right here. I'm going to remove it in 3, 2, 1. Alrighty, you're doing good, Mrs. Smith. You're doing good. You're doing good. Oh, my goodness. It's getting caught in the paper towel. Stop. Okay. Okay, you're doing good. You're doing good. Okay, great. And what I would do with this is I would throw it away in a biohazard bin. And so this is my bin over here. Okay. You got some stuff coming out of your face. Just kidding. Anywho, so we have removed the NG tube. Are you feeling any discomfort or anything like that? Oh, one thing I did forget to mention. You always want to check the area around the nair to make sure there's no irritation, redness, swelling, bleeding, anything like that. You always want to make sure that that the patient is also comfortable along with their nair that you inserted the NG tube in. Okay, is there anything that I can get for you? I know you're feeling a little uncomfortable. We're gonna start you off with a liquid diet, maybe just ease you into it. You can't go into solid foods right away because you haven't had food in a while. So probably liquids first, everything like that. I'm going to position the bed. Oh, just kidding. No. You can have your pillow back. Yay. Gloves are clean. Okay, the pillow is back where it needs to be. Call light is in hand. Let me move this bed. The sheets on the bed was not me, I promise. Okay, wheels are locked, bed is in lowest position. Side rails are up ×2, and call light is in hand. Have a wonderful day, Mrs. Smith. Okay, anywho, so the person recording for me, Alejandra, she literally did this. She messed it up so bad. She accidentally stopped the video, so I didn't get to say what kind of documentation to provide. But after the NG removal, you want to clarify what time it was removed, what NG tube was removed, which nair it was removed from, who removed it. You also want to document the patient's tolerance, if they were able to understand the education that I was providing for them about the NG tube removal, educating them about the diet that comes afterwards, and just kind of how they'll be feeling, and if they feel any discomfort at all, anything like that, that they should use their call light and call us. We will be more than happy to go and help them. So that was it for this video, and I hope that y'all enjoyed.